Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. Induction of labor is common, and there are so many medications your healthcare provider may choose from to use as part of this process. Today we will be telling you everything you ever wanted to know about the labor medication Cervidil. So click those like and subscribe buttons and stay with us. Cervidil is also known as dinoprostone. This is a medication that comes in jelly, or vaginal insert, and it contains basically a synthetic prostaglandin. Prostaglandins are hormones that we produce in our bodies naturally. These hormones, when you're pregnant, are designed to ripen the cervix, to help it dilate, efface, and thin. Usually, these soften the cervix, but Cervidil itself does not usually start your labor. It just gets you ready for labor. If we decide to use Cervidil, the first thing that we're going to have you do after you've been admitted to the hospital is we're going to feed you. We want you to eat because you're not going to be able to eat for at least 2 hours. We're also going to have you walk around just a tiny bit and make sure you use the bathroom because once we've put the medication in for 2 hours, we're going to need you to stay in bed. Then we will lay you back and we will go ahead and place the Cervidil. The Cervidil is like a flat cotton tampon that has the medication infused into it. So what we need to do is take sterile gloves and slide it up next to your cervix. After those first 2 hours in bed, you're going to be able to eat again, you can get her out, you can walk around as long as your healthcare provider says so. We will leave that Cervidil in place for 12 hours. Now, just like a tampon, it has a little cotton string. If at any point in time we need to remove it, or if the 12 hours are up, we go ahead and pull it out using the string. Now, after the 12 hours, if we decide to do a second dose, we will let you eat again before we proceed because again, you'll be in bed for 2 hours. While we're using Cervidil, we need to do continuous fetal monitoring to make sure you don't develop an abnormal labor rhythm and make sure the baby is doing okay. This is extremely important for the health of you and your baby. There are many things that we look for to know if Cervidil is working. Some of those include signs that labor has started, even though that's not its primary indication. So this can include mild cramping, backache, pinkish vaginal discharge, or contractions. And of course, additionally to that, we're looking to see if the cervix is dilating and effacing, which is a good sign that labor is about to start. Please remember to hit the like and subscribe button so you can get our latest content. As with any other medication, Cervidil does have some side effects. The most common side effects are stomach cramps, diarrhea, nausea, and vomiting. You might also get a fever or feel dizzy or even get a headache or flushed skin. That's all kind of normal, and as long as it's not severe, you may just receive some medication for these side effects. However, one of the things that we do look out for is something called uterine tachysystole. Basically what this means is that you are having contractions that are too close together. This can cause a problem with the baby, including fetal distress. So at that point, we would remove the Cervidil. When deciding to use Cervidil, we need to look at certain risk factors and precautions before we decide to administer it. It's discouraged to use Cervidil if you have anemia because there is an increased risk of blood loss after using Cervidil. Asthma means that you cannot have Cervidil because Cervidil can cause the blood vessels in the lungs and the lung passages to narrow. This could induce an asthma attack. Cervidil may be the cause of a uterine rupture if you've had a previous C-section or uterine surgery. A uterine rupture is where the uterus tears open and it's a medical emergency. We can't give you Cervidil if we're using any other labor medications at the same time, like Pitocin, because this increases the risk of many contractions all at once, which could put the baby into fetal distress. There are some rare risks that could happen when using Cervidil. One of those is an amniotic embolism. This is where a little bit of the amniotic fluid can get into your bloodstream and it can travel to the heart or lungs, causing failure. And finally, Cervidil is associated, with an increased risk of DIC, which is disseminated intravascular coagulation. Basically, this means that you can develop blood clots more easily, and these blood clots can block vessels in organs, causing damage. As I mentioned in the beginning, there are many medications we can choose to help induce your labor. Besides Cervidil, one of the medications is Cytotec, which is also a prostaglandin. It is also used to help ripen and soften the cervix. The biggest difference between Cytotec and Cervidil is the route of administration. Cytotec is a tablet that we either insert into the vagina or we give you by mouth. It is given every 2 to 6 hours. But unlike Cervidil, if you start to develop rapid contractions, we cannot remove Cytotec. It's either dissolved into the vagina or you've taken it orally, which is why often we choose the Cervidil, which can be removed. Pitocin is synthetic oxytocin. This is the hormone that helps to induce contractions. It's used to start them and to strengthen them. Contractions help to efface and dilate the cervix. That means thin it out and open it up. However, if your cervix is very long, it's thick, it's not soft, that means the Pitocin won't work as well, and this may end up as a failed induction. I hope this video has helped you learn everything you ever wanted to know about Cervidil for the use in your labor induction. Please share your comments and let us know what topics you would like to hear more about. Remember to click the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.